Wacklisi, Chair Murkowski, Vice Chair Schatz, and distinguished members of the Senate Committee on Indian Affairs. I'm Mark Cruz. I'm deeply honored, as are my family, the Klamath tribes, and my fellow Oregonians, that President Trump has nominated me to serve as the 12th director of the Indian Health Service. My life has been profoundly shaped by people who took a chance on me. Growing up in a rural community, I am forever grateful to the families who opened their homes, gave me rides to games, or made sure I had a meal. In that same spirit, I'd like to make a few acknowledgments. First, I want to thank Chairman Tom Cole for his generous introduction. He gave me an opportunity right out of grad school and has been a constant source of advice, counsel, and support throughout my career. Second, I want to thank my brother Cougar for being here today and recognize my sister Shawnee, who couldn't join us. I also honor my late brothers Cody and Victor, who remain in my heart. I want to give a heartfelt thank you to the many friends that I have here in the room. Many from my hometown of Klamath Falls, Oregon, and my tribal delegation, Chairman Ray, Angie Wilson, who runs our health, and Councilman Jackson, and my best friends Kyle and Blake. I also want to recognize the BIA director who's joined us here today, a good fellow friend and Oregonian. And I want to thank the people who have sent prayers, both traditionally and by text message. They both count. I appear before you today humbled and grateful, ready to share my story and my vision for the Indian Health Service. As a proud citizen of the Klamath tribes, a first-generation college student, and a former foster child, as is far too often, I come from a broken home. I'm the son of a deported drug dealer and a lifelong addict. I'm also the grandson of Barbara Unive, who, after overcoming colon cancer at the Santa Fe Indian Hospital and leaving a comfortable life in Dirksen, New Mexico, she returned to Klamath to raise me and my siblings. Her love and sacrifice made everything that followed possible. In some places, it takes a village to raise a child. In Indian country, it often takes an auntie or a grandmother. For more than a year, I have served as senior advisor to HHS Secretary Robert F. Kennedy, Jr. I thank the Secretary for creating this position in response to tribal leaders' requests and for entrusting me with that role. I work closely with department colleagues, tribes, and advisory committees to address the variety of issues that come before the department. That also means going to your states, such as Alaska and New Mexico and Oklahoma and North and South Dakota, amongst others, where I coordinate and collaborate with other federal agency leaders to address issues brought forth by tribal communities and promote healthcare affordability and improve nutrition in Indian country. If confirmed, I am committed to continued rigorous engagement and follow-up. Life in Indian country can be extraordinarily difficult. As a former high school teacher on the Rosebud Reservation, I saw firsthand the devastating effects of suicide, substance abuse, missing and murdered Indigenous people, gangs, economic hardship, and chronic disease. While these challenges persist, I have also witnessed the extraordinary dedication of healthcare providers, teachers, and law enforcement officers, both native and non-native, who walk into our communities every day and work tirelessly to empower the next generation. Last summer, I visited the Rosebud Hospital. While I saw the real challenges with workforce, facilities, management, my spirit was lifted when I heard someone call out, "Mr. Cruz." It was one of my former students from St. Francis, who is now working the front desk 12 years later. In that moment, I was powerfully reminded why I'm called into this work. Committee members, I firmly believe that tribal consultation is a process, not an event. Tribal leaders in Congress can count on me to engage early, listen carefully, and be transparent. I am realistic about the challenges, but optimistic about what we can achieve together. With strong federal, tribal, and urban Indian health partners, outcomes will continue to improve. We see this in the work to return traditional first foods, the Secretary's work to address the chronic disease epidemic, work in the special diabetes program, amongst many others. If confirmed as director, what I will bring is direct, lived experience in the communities and systems I would oversee. My family, my friends, and my tribal community will live with the consequences of that work I do for decades to come. I would welcome that challenge, and I'd be honored by the opportunity. Thank you for the consideration of my nomination, Sepketcha.